Hello, my dear friends. Myself is Prof.Dr. Deshpande. Today is Monday, that is the 4th of March 2019. This is the second audio video of today. The topic of this presentation is regarding whether Ayurveda is eternal. This is a very curious question asked by so many people at all the time. Because it is always said that Ayurvedic science is eternal, permanent. Ayurvedic science, life science, it was before in the past, it is present today, and it will be present in future. That is called as eternal, not destroying. So it is a permanent science which will be helpful all the time to all the people. So the people, especially scientific people, they doubt in this regard. They ask the very simple question, Doctor, now the research is going on, all the sciences are upgrading themselves by the research, and you are still saying that the science, the information mentioned 5,000 years BC by Charak, which is your, the best master, guru, that what he has told 5,000 years back is still possible that it is applied today. Don't you have seen the Gray's edition, the modern books editions? The different editions are coming, 17th editions, 20th edition, last 100 years. This is the history of science. And you are saying Ayurveda is science, which is not changing. How it is possible? So, my dear friends, this is totally misunderstanding and confusion in the mind of people. The simple answer is, Ayurvedic science is eternal. Yes, this is true, 101% true. How? Ayurvedic science is eternal by its principles. That is, in Sanskrit it is called as a Siddhanta. The word is Siddhanta. Ayurvedic Siddhanta, Ayurvedic principles, fundamental principles are eternal. That is why Ayurvedic science is eternal. We are not talking about the practice. I will give a simple example. Human being, for example, 5,000 years back, 100 years back, 200 years back, have you seen the history of the human being? Okay, forget about monkey is transferred into the human being. But human being as such, when we talk about human being, have you found that there is a change in your two eyes, 2 ears, tongue, then the stomach, then the intestines, all the anatomy, digestive system, respiratory system, circulatory system, whether there is a different systems in 5,000 years back and now we have totally different systems in our body? No. My dear friend, this is not true. The human body structure, human body anatomy, human body physiology, that is functioning of the organ. Heart at that time was circulating the blood, and this time we are also having the heart which is circulating the blood. Charak had the brain which was engaged in controlling the sensory and motor organs. This today, myself, Professor Deshpande, is also the brain, which brain is also controlling sensory and motor organs. In short, my dear friends, try to understand if the human body structure, human body anatomy, human body physiology, human body organic functions, and also the problems developing in that, if they are having the same physiology and anatomy, then why should the principle should change? Principle should not be changed. And that is why I will give another example. How I am saying principles are same and other things are changing. But before that, I must clarify that the definition of Siddhanta, definition of principle, definition of hypothesis in the research language is mentioned by Charak Rushi, Charak Sir, in his text of Charaka Samhita. The section is Charaka Vimanasthan. I will read one shlok for you. This is in front of me in the book. Siddhanto Nama. This is the definition of Siddhanta. What is the fundamental principle? How it is formed? Siddhanto Nama Sa means that Yaha Parikshakair Bhavidai. Parikshakair Bhavidam Pariksha. Parikshakair Bhavidam Pariksha. That means you have to examine the things, examining the facts. Pariksha means examination. Bahuvida, different things you have to examine, to test, to make experiments. Pariksha. Pariksha means experimentation. Pariksha means examination. There are hundreds of examination methods at that time and today also. But what is the importance in establishing principle? What is the importance? You have to examine the facts. You have to examine. You have to test. You have to make the experiments. Then, hetu bhishcha sadhayitva. You get some conclusion. Hetu bhishcha sadhayitva sthapyate nirnayaha. Sthapyate nirnayaha. Hypothesis is established. In today's research, when you are doing post-graduation, when you are doing PhD in physics, chemistry, biology, medical sciences, there is always a definition, different definitions. In the research also, when hypothesis is not there, first there is a research question. And then that research question is proved by the different experiments, different tests performed by the researcher. And after his completion of the synopsis, completion of the thesis, completion of the dissertation, research project, research paper, he gives that this is a final my hypothesis. And that particular principle is carried, it's used by the different researcher. So, in Ayurveda, in Sushruta, all these people have given you two things. Try to understand. Charak, Sushruta, Vagbhat, these are Ayurvedic scientists. These are Ayurvedic master teachers, Mahaguru, master teacher, best teacher. So they have given you two things. Remember my words. One is a Siddhanta, principles, and second, applied part. First, principle, second is applied part. So why Ayurveda is eternal? These principles are permanent, but this applied part is changing. Remember my words. Applied part is changing. And science is not called on the basis of applied part. Science is based on the principles. Any science, physics, chemistry, biology, medical science. And that's why I will give you one simple and sweet example. How the principle is remained same and the applied part has been changed. For example, Charak says, there are three methods to examine this patient. Charak says, there are three methods of examination of patient that will not change. Remember my words. Darshana Sparshana Prashnaihi. Darshana Sparshana Prashnaihi. These are Sanskrit words. Darshana means to see by eyes or inspection. Sparshana, to touch. To touch. You have to touch to the patient by your hands or by anything else. But you have to touch. So that is Sparshana. And Prashna is an interrogation. History taking. So these three methods are the examination method for any patient 5,000 years back, 100 years back, and even today. That has not been changed. When we want to examine any patient of rhinitis, cancer, AIDS, IHD, diabetes, what we will do? We will see the patient first. Without seeing the patient, no treatment is successful. Now, there is a development of microscope. With the microscope we can see, but principle of seeing something, is that been changed? No. We are now using the scopy, gastroscopy, esophago-gastro-duodenoscopy. All scopies are there. We are looking inside. But principle to look, to see, is that been changed? No. Sparshana. Sometimes previously it was only temperature by just touching to the, even some doctors today, they just put their hands like this, Sparshana, touch and see the temperature. But now we have the thermometers, we put it into the axilla and see the temperature. But my thermometer is touching to the body, that is Sparshana. My stethoscope is touching to my heart, touching to my chest, and I am seeing heart sounds and lung sounds and respiratory sound. But Sparshana principle is not changed. What has been changed? The use of instrument. Applied part has been changed. Prashna, interrogation. There are different methods of interrogation. So what I mean to say, darshana, sparshana, prashna, these three methods will not be changed in the past, in the present and in the future. This is principle. How you can apply that principle is a different thing. Another example from Sushruta. He says, to avoid the complications in the surgery, sterilization is a must. Use of fire to sterile, to heat, use of heat principle is essential. Now at that time they were directly putting on the fire. But today we have the sterilizers, we have the autoclave. But heat will destroy organisms. H-E-A-T, heat will destroy organisms. This is the principle mentioned by Sushruta. Whether that principle has been changed? No, not at all. Still we believe or we confirm that yes, because of the boiling of the water, microorganisms will destroy. So again, my dear friends, try to understand Ayurveda is definitely eternal, but two things are there. Any science, one is principle and another is a practice or applied part. So practice may change, but principle should not be changed. And this is the conclusion of this lecture, that Ayurveda is eternal. That means Ayurveda was useful in the past, in the present and in the future, but only with the principle. So thank you very much. Have a nice day. Thanks.